Hi, Will. How are you
Hey,
today?
doing good. How are you?
I'm fine, and you know that it's very important that I feel well because nowadays in the US you must feel well. You shouldn't need to go to the doctor because it's you don't get your service on time, I guess.
Yeah, it's been challenging here recently.
Yeah, yeah. I'm fortunate I'm in Israel, so everything is smooth. But tell me, what is going on in the US?
Yeah, so there was a major attack, at the I think it was the end of January, early February, that affected Change Healthcare, and this attack, has affected hospitals and medical providers across the country, and delaying care, delaying prescriptions. It's been massive.
Wow, wow. What was it? Was it a ransomware or something like that?
So it was ransom, and it was kind of a multifaceted attack. But what's interesting is it looks like it was actually a computer remote management tool, that the IT team was using, that allowed the attackers to launch this attack.
Oh, so again, the same thing again.
It's same thing. We've been down this road, a couple years ago with Kaseya, and then before that, SolarWinds, and it's looking like this was one of the same hacking groups that were involved in those attacks. So it's starting to become an attack pattern for these threat actors to use these legitimate tools, and not malware, that to break into these systems.
Yeah, so now I'm just begin to start to be worried because we have an MSP. Probably in the US, there are hundreds of thousands of MSPs, which are responsible to take care of lots of companies and using such tools. So what should we do? How can we make sure that it will not be the attack vector that will going to influence us?
Yeah, it's that's a difficult question. It's very hard as an MSP, to have an RMM tool, remote monitoring and management tool, that is running their livelihood. um we If we look at the technologies, it's like, we've got trusted IPs that we can say only these IPs can connect to our system, or multi-factor authentication. And so, there's some controls that can be put around it. But if the flaw, like in the case of Change Healthcare, was a self-hosted version, there's a lot more
Mhm.
controls that need to be put in place besides the trusted IPs and the multi-factor. If you're hosting the infrastructure yourself, that's when we start getting into web application firewalls, VPNs, things like that, that are extra, that we need to put in place to protect that infrastructure. But it's not just protecting the customer, but also protecting the MSP, because if the attack is there's a big question of liability.
Yeah, yeah. And do you think that is special to healthcare? So if I'm in a different vertical, I'm more protected. So these attackers are they looking for healthcare companies?
So, I think this particular attack was targeting healthcare. So the threat actors have been targeting healthcare heavily. I think the latest reports on the value of data that's being sold on the dark web, health records
Hmm.
are the most expensive.
Yeah.
I think we're past the days of the 90s where credit cards were the most valuable, and now it's healthcare data.
Wow. Yeah. So what do you recommend should I do? So we talked lots about frameworks and the way that we should protect ourselves, but now it's not only protecting ourselves as a company. Should I um, make sure that the MSP is well protected, or using a well-known tool with all the right patches, etc.?
Yeah, I think it's multifaceted, right? So as a business owner, and founder, some of the things to look at is third party due diligence,
Mm,
right? How are you assessing the vendors that you're using? Are you putting in measures in place to check their cybersecurity? Figure out, talk to your MSP about what they're doing to protect your business, and you know have those plans in place that if an attack like this happens to your business, how do you respond to that? How is the MSP going to help you respond to that?
yeah, it's complicated because I guess most of the companies trust the MSPs, and if the attack comes from the MSP, it's like, you know, can you trust, or how can't you trust the one that you should trust?
Yeah, and it's a matter of, the MSPs, they're doing everything they can to keep their systems secure. But software is vulnerable. There's not a single
Mm,
software that, we're not every patch Tuesday and every update, scrambling to get things updated and waiting for the next 0 day. And, by the time a 0 day or, these patches are released, this vulnerability has been in the code. It could have been for years before it was discovered. So, that's why we've moved into this zero trust model, is to assume that every device is already infected.
mhm.
Because, when we're looking at these things, some of these vulnerabilities, aren't found for years. And then once they're found, it's like, okay, how long has a threat actor been working with this that we didn't know?
Yes. So from 0 day to zero trust.
Exactly.
Yeah, 0 day is some vulnerabilities that haven't been known to the public, and attackers are using that as long as these vulnerabilities are not discovered. And yeah, um, yeah, it's super interesting. So Will, what do you think companies and maybe MSPs should do after these attacks? Are there lessons learned that we have to follow? Something new
I,
that we have to do because of this new attack?
I think so. I think the things we need to look at, it's like this particular attack, the system that was vulnerable was the self-hosted version. Right, the
Hmm.
cloud hosted was not, but the vendor did come out very quickly and provide updates. And so any attack that we see like this in the news, we need to understand what we can do immediately, right? So if we're using the software that was used in the attack, then it's getting that update, it's putting those protections in, and it's also saying, okay, how can we maybe look at our incident response and say, how would we detect this in our own environment, and how can we make ourselves better so that if we do see this
Hmm.
ourselves, that we can respond to that?
Yeah, interesting. We don't have enough time, but maybe next time I would like to talk with you about advantages and disadvantages of using the cloud or on-prem. Because in this case, if you are on the cloud, you will be protected, and on-prem, more risks. But I guess in other cases, it's the opposite. So interesting
Exactly.
conversation for next time.
Absolutely.
Yeah, thank you, Will. Take care. Be healthy because, healthcare is in dangerous.
Well, it'll get better.
Yeah, I hope so.
All right. Thank
Yeah, bye bye. Thank you so much.
you. Bye.